We are covering the Allen test, a critical procedure you must know for your phlebotomy certification exam. The primary purpose of the Allen test is to assess for adequate collateral circulation before performing a radial artery puncture, most commonly for an arterial blood gas or ABG collection. Your hand receives blood from two main arteries, the radial and the ulnar. The Allen test ensures that if the radial artery were to be damaged during the puncture, the ulnar artery can still supply enough blood to keep the hand healthy and prevent ischemia. The exam will refer to this as the modified Allen test, which is the standard unilateral procedure used today. Let's walk through the procedure step by step, as you'll be tested on this sequence. First, locate both the radial and ulnar arteries on the patient's wrist. Apply firm pressure to both arteries simultaneously. Next, instruct the patient to clench and unclench their fist several times. This helps to push the blood out of the hand. Once the hand becomes pale or blanched, have the patient relax their hand in a neutral position. Now, and this is the most critical step, you release the pressure from the ulnar artery only, while maintaining firm pressure on the radial artery. Interpreting the results is where many exam questions will focus. A positive Allen test, which is a normal and desired finding, is when the hand flushes and returns to a pink color within 5 to 15 seconds. This indicates that the ulnar artery circulation is sufficient and it is safe to proceed with the radial artery puncture on that arm. A negative Allen test, which is an abnormal finding, occurs if the hand remains pale for more than 15 seconds. This means the ulnar circulation is inadequate, and you must not use the radial artery on that arm for the puncture. Now let's talk about exam traps. The most common point of confusion is the terminology. Remember, a positive test is a good thing. It's positive for good circulation. A negative test is a bad thing. It's negative for adequate circulation. The exam will present scenarios like a phlebotomist performs an Allen test and the hand remains pale after 20 seconds. What is the next appropriate action? The correct answer will be to document the negative result and assess the other arm. Another trick is wording that might confuse which artery to release. Always release the ulnar artery to test its competency before you puncture the radial artery. Here is a simple mnemonic to help you remember the key action. Release the ulnar to see if it's usable. This links the action of releasing the ulnar artery with the goal of determining if the radial artery site is usable for the procedure. The exam expects you to know not just the steps, but the clinical decision-making that follows. A negative test is an absolute contraindication for puncturing that radial artery. Performing the procedure despite a negative test could lead to severe complications like hand ischemia. Understanding this safety aspect is crucial for passing your exam. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.